Today I want to share my thoughts and insight on using Ozempic and other similar medications for weight loss. My name is Dr. JP Guidry. I help golfers, baseball players, and athletes of all kind perform better on and off the course, get out of pain, lose weight, and get healthy. Ozempic and similar drugs have kind of become the drug du jour for weight loss. And so because I have a lot of clients that have asked me on this, I've done a little bit of research and just kind of wanted to share my insights. So I'll start with a disclaimer. I'm not a medical doctor. I'm not going to advise you on taking or not taking drugs. I'm just going to share my insight around this. So from what I've seen, Ozempic and similar drugs have been very successful in losing weight. Okay, so for taking it for that purpose, it seems to be successful. Now, I know there's some back and forth on should it be prescribed for this, and getting into some gray areas of that, but I won't touch on that because I'm not a prescriber. That's not what I do. I just try to help and support my clients in getting their weight loss that they want and their health in the best possible way for them. So the reality is I have some clients that have started on this drug, so I want to make sure I support them through this. So the pros of it is a very effective way to lose weight. And the way I understand it, kind of it works on your feelings of satiety and hunger, and kind of mutes that both at the intestinal level and maybe even at the brain level. But again, not going to dive into the whys and hows it works because I'm not an expert on that. I'm just going to dive into the stuff that I've read as far as the pros and cons of taking it, and how, if you are going to take it, the best way, in my opinion, to approach that. So, so the pros, okay, it seems to work pretty well for weight loss for those that take it. So let's talk about the cons. Well, number one, if you look at the research on it, it shows that there is a fair amount in that weight that you lose. There's a fair amount of non-fat mass that is lost. So what does that mean? Well, that's mostly going to be skeletal and muscle mass. So obviously losing bone and muscle mass can be detrimental to a lot of things, especially for aging adults. So that can be a pretty high negative. Number two, there's some decent side effects. I don't know all the side effects, but the ones that are most commonly experienced: nausea, vomiting, some constipation, diarrhea, even some severe indigestion. So mostly not at the level of life-threatening, but definitely can be an inconvenience in your day-to-day life. A lot of times what you eat can trigger that, so some of that is figuring that out along the way. Number three is there tends to be a high incidence of what we call rebound weight gain, which is just essentially gaining all or more of the weight back that you lost on it. So that's probably one of the biggest problems I see is you get on it, you lose weight, you get off, and that's with a lot of these, I won't call it fad things, but a lot of these kind of extreme ways of losing weight that can be effective at losing weight short term, but don't really tend to be effective long term. So how can we combat? If you're going to take it, my first piece of advice would be try to lose weight in other ways by changing your eating habits, increasing your exercise and activity, going that route first. At the very least, if you do those things and still end up getting on some kind of a drug to help, you will at least start to change your approach to food and exercise and activity, which will in the end help with that, prevent that rebound weight loss or weight gain. So number one, let's deal with the loss of muscle mass. The best way we can counter that, if we're going to take this medication, is to continue strength training, resistance training, and to make sure we're focusing on protein intake. One of the biggest reasons this drug works is it tends to decrease your intake overall, so you're just taking in less calories. Well, part of that is you're also going to be taking in a lot less protein. So it's imperative to make it a priority that you are getting as much protein you can within that, and continuing to or initiate a resistance training program while you're on this drug, and really while you're off of it as well. That will help at least curb some of this loss of skeletal and muscle mass that goes along with this. As far as the rebound weight loss, one of the biggest issues I've found with this drug is there's a big lack of support from the prescribers in changing the other aspects of dietary habits, eating habits, and that along with it. So again, you get on the drug, it does what it does, you eat less, you lose weight, but you haven't really changed anything. So as soon as you get off of it, well, guess what? You're going to go back to your old habits, and more than likely you're going to regain that weight. So my advice, and again, what I try to help my clients with, is if you're going to get on this drug, then to have a plan, and while you're on it, even before you're on it, work on starting to change your habits and your approach towards food, towards eating. So figuring out for you, normally, where do you take in most of your calories? Is it certain meals? Is it snacking? Is it certain foods? And figuring out how to start to change those things without going extreme, without cutting everything out, and just changing your approach and your habits to food. Sometimes there could be psychological issues where, that needs to be addressed through a mental health counselor as well. So while you're on it, before you're on it, after you're on it, make sure that is a big part of your approach, because this will help curb that rebound weight gain once you get off. The whole point of this is, I think the benefit of this can be, it can kickstart a weight loss journey because it is effective at that. But I think it's misused and not well approached through the providers that are prescribing it, because there's no support along with that. So you rely on the medication, it works. Once you get off the medication, you've got nothing to fall back on to continue to keep that weight loss and to maintain your health. So hopefully this provides some insight. Again, I'm not an expert on this. This is just based off some of the reading and the research I've done around the drug, and some of my experience working with clients that have either asked me about it or have actually gotten on it. If you have any questions, obviously specifically about the drug, reach out to your doctor. If you have any questions about improving your overall health, weight loss, performance, swing speed, bat speed, throwing velocity, so on and so forth, you can email me at johnpaul@guidrypt.com. Find more out about me at guidrygolfandsport.com.